again, my name is Dr. Williams. I'm a fellow at Stanford Pain Medicine. I'm one of the pain medicine fellows graduating this December. A little bit about me is I did my undergraduate training at Clemson University in biomedical engineering. I then went on to the Medical University of South Carolina, where I got my medical degree. And then after that, I went up to New York City, where I got my anesthesia residency training at NYU in Manhattan. And then shortly after that, I came here to study pain medicine at Stanford. All right. So before I get started, I just want to kind of give some rationale behind why I chose sickle cell disease and why I think it's really important. So the reason why I chose it is because the pain process and pain in general is it's a pretty widely understood process throughout the human body and across like many socioeconomic factors and people from many various backgrounds. And so sickle cell disease, while I wanted to highlight this disease, the pain process is one that is common and known to many. And I think that no matter what disease or diagnosis or condition that you may have, a lot of the treatments that people use in this process can also be used in a multitude of other conditions as well. And so just to get started, so what is sickle cell disease? Gonna move my here. So sickle cell disease is a group of inherited red blood cells disorders that affect hemoglobin. And hemoglobin is a protein that carries oxygen throughout the entire human body. And so normally red blood cells are disc-shaped and flexible, as you can see here. And they can move through the body, move through the blood cells with ease and not get kind of like clumped or caught up. However, in sickle cell disease, the red blood cells become crescent or sickle-shaped due to a genetic mutation of the hemoglobin gene that allows them to lose their cellular structure, as you can see here. So this would be a sickle cell red blood cell, and this would not be. This would be like normal ones that people who do not have the condition would have. And these sickle red blood cells do not bend or move easily and can block blood flow to the rest of the body. And so as you can imagine like a circular tube, and you can see how these regular red blood cells can easily pass through a 3D cylinder, right? However, you get these kind of weirdly odd-shaped sickle cells that can clump the cylindrical tube, that is the blood vessel, inhibiting blood flow to certain areas of the body that can cause ischemia, or as people know it as decreased oxygen to certain parts of the body, which could cause a lot of inflammation and pain. So who is affected by sickle cell disease? So it affects more than 100,000 people in the United States and 20 million people worldwide. And so, as you can tell, most of the people are African-American descendants. In the U.S., most people who have sickle cell disease are African-American, are of African ancestry and identify themselves as Black. 1 in 13 Black or African-American babies are born with sickle cell disease, and then 1 in every 365 Black or African-American babies are born with sickle cell disease as well. All right, so symptoms can range from slight anemia to severe anemia. Anemia is just like a low red blood cell count, which can cause extreme tiredness, dizziness, shortness of breath, and fatigue, or even an irregular heartbeat if it gets severe. Jaundice can also be known as yellowing of the skin or whites of the eyes, is a common side effect of sickle cell disease. And that's just due to severe red blood cell breakdown, causing a leaching out of chemicals in the human body that causes the yellowing of the skin and the eyes. Painful swelling of hands, feet, fingers, toes, or joints. This painful swelling, again, is due to that decreased blood flow to these really small, sensitive joints in your fingers. And people typically experience these pain symptoms in the peripheral limbs. So like in the smallest pinky toe or big foot is where people essentially experience pain first. And then as the condition becomes more severe, it can spread towards the center of the body as well. And so that can lead to what we call pain crises, or episodes of periodic extreme pain that occur pretty much anywhere in the body, but most often is in the chest, the arms, and the legs. And also to note, the severity of the disease is related to if you have sickle cell disease versus sickle cell trait. And so as you can see here, you have a mom and a dad, and they have 4 children. Now, as you can see, each parent is a carrier for the disease. So that means they have sickle cell trait. And if you're just a carrier for the disease, that means you just have a slight mutation and not a full mutation that could cause sickle cell. And so if you're a carrier, you could potentially have little to no symptoms at all and lead a completely healthy and normal life. However, if you're a carrier and your partner is a carrier as well, you guys could eventually and ultimately have a child with sickle cell disease, which you can see here on the bottom left. So this child would experience all these symptoms of anemia, jaundice, pain crises and pain episodes, and arthralgias. And then their siblings could be essentially unaffected. However, the pairing of the genetic code is very randomized, and it's hard to tell which baby will be born with it before they're conceived. So that's why we come down to prenatal screening. So this is how you kind of can diagnose sickle cell disease early on. And it's really good because these patients are typically diagnosed as children. And so we can catch the disease early on and learn how to manage it going forward. And so the prenatal screening is done as early as 8 to 10 weeks into the pregnancy, and it looks for the sickle hemoglobin gene rather than the abnormal hemoglobin itself. So it's looking for the actual genetic mutation rather than just looking at the red blood cell. And then you have newborn screening as well, which is done a little bit after birth. And essentially every baby gets one genetic test, as it's like a heel stick test, and it tests for a plethora of genetic abnormalities, and sickle cell disease is one of them. And then afterwards, for more advanced confirmatory testing, so let's say you have a baby and they're positive on the prenatal screen and a positive newborn screen. Screening tests are essentially tests that allow us to make us hypervigilant to people that we have to confirm for an actual condition. And so if you have a patient who has a positive on both screenings, you would then follow up with the blood and genetic testing to confirm the actual diagnosis, and therefore allow them to go through the treatment process after that. All right, and so understanding pain and sickle cell disease. And so as you can see, like I mentioned before, your blood veins and your blood vessels and arteries are cylindrical in shape. And as you can tell, red blood cells that are normal typically should pass through them with ease and kind of deliver oxygen throughout the entire body. But as you can tell, if you introduce sickle cell red blood cells into the body, you can kind of cause like a traffic jam or a clogging of the arteries. And this limits oxygen and limits blood flow to the peripheral tissues. And so when tissues don't receive oxygen, they then go into what they call like an inflammatory state, which can be experienced as severe sharp pain or cramps. And again, this will mainly affect the distal limbs first, so your small fingers, small toes, and then as the condition worsens, it'll spread to then affect more the chest and the large muscle bone groups like your shoulders and hips. So as you can see here, in addition to this painful swollen hand, you will also have the symptoms of the anemia as well, because your functional red blood cells are essentially lower than that of a normal human being. And so you're going to be more fatigued. You're going to be a little bit decreased ability to work out, go to the grocery store, do your ADLs, and sometimes even walk, and you're just so tired. And so that, and combined to the severe pain symptoms that these patients experience, their overall quality of life can be severely affected. And so that's where we come in, and we consider pain management as one of the crux of their treatment plan. All right, so causes, and so these patients, as you can probably tell, they do experience some chronic pain throughout their entire lives. And unfortunately, a lot of the pain is just mitigated by temporizing treatments with IV medications. Some procedures can help as well. But for the most part, these patients do experience lifelong pain. But they experience different types of pain. And so, as we've discussed already, with the decreased red blood cell distribution to the joints of the fingers and the toes and the limbs, this causes acute bony pain, which is like a dull ache, kind of arthritic pain that some patients can describe. And then in addition to that bone pain, you also have just when the body doesn't receive oxygen, sometimes cells, red blood cells, bone cells, even muscle cells, they can become very irritated and agitated, and they can become inflamed. And so this inflammation releases systemic chemical modalities that can cause a lot of inflammation and a lot of tenderness around like large muscle groups, again, mainly involving the larger joints, the limbs, the lower extremities, upper extremities as well. And just as muscles and bone and blood vessels are damaged in this condition, so are nerves. And so when nerves don't receive enough oxygen and when nerves don't receive the blood they need to function and survive, sometimes they are damaged as well. And a damaged nerve, when it's firing, can give off what we call neuropathic pain. And so in addition to this bone pain, inflammatory pain, these patients are also dealing with this like sharp shooting, burning neuropathic pain that sometimes you'll see in like a diabetic patient or someone with peripheral vascular disease. And then these patients, because they do experience pain from many pain generators, they often are placed on a lot of opioids just to treat their chronic and then their long-term symptoms. Because opioids are essentially how we treat these people when they're having these acute flares. However, as you can tell, patients are diagnosed from a very early age. And so if you're exposed to opioids for a prolonged amount of time, sometimes opioids can do a little mind trickery and actually cause you to experience more pain than what you would have before the opioid treatment. And so with chronic opioid therapy, you can begin to develop opioid-induced hyperalgesia. And all four of these pathways kind of lead to a process which is called central sensitization. And chronic pain and sickle cell disease, and essentially in many other conditions as well, like rheumatoid arthritis, Sjogren's, any kind of other autoimmune disease, a lot of these patients that have these chronic long-term conditions with several pain flares can lead to central sensitization, where their body is just processing pain multiple times a day, and it really affects how they experience pain and how the body can process the pain. All right, so I want to focus on this, and then I want to stop here because this is where you can actually take the concept of chronic pain in general and really spread it across multiple conditions like rheumatoid arthritis, autoimmune disease, chronic CRPS type pain, fibromyalgia. So pretty much any pain that is any patient that has chronic pain and has dealt with it for a prolonged amount of time can experience this central sensitization type of picture, which can make their pain management really complex. And so just to back up, so central sensitization is just an increased responsiveness of nociceptors. And so a nociceptor is a pain receptor. And so when your body experiences pain, the thing that kind of facilitates your body experiencing it is the nociceptor on a chemical level. So an increased responsiveness in nociceptors to normal, painful, and non-painful stimuli. And so this hypersensitivity to pain leads to both allodynia and hyperalgesia. So just kind of to give you some definition behind those two words, hyperalgesia is an increased pain perception incongruent to the degree of noxious stimuli. And so to break that down, so let's say that you have a paper cut, and a paper cut for any other person that doesn't have chronic pain or is just going throughout life. A paper cut is going to be a paper cut. You see it, it's a little bit painful, and then you can move on about your day. But with this patient, especially in sickle cell disease, this who has like this central hypersensitivity to pain, that paper cut can be pretty in the moment catastrophic, and it can be experienced as this severe sharp pain that can be super hard to control. And again, this is all just due to the central nervous system misfiring and misprocessing the stimuli that's being input to the body. So that's hyperalgesia. And then you have allodynia. Allodynia is pain from a stimulus that is not normally painful. And so that's like light pressure, touch, heat, or cold. And so many of you who might be knowledgeable of CRPS, kind of the one kind of trait that they have is when you go to bed at night and you have like a cloth or a sheet that you put over your feet, and that just the feeling of the sheet on your skin causes severe, severe pain. And that is kind of what an allodynia picture looks like. And a lot of patients with sickle cell disease tend to develop this later on in the late stages of the disease as well. All right. And then again, this picture of central sensitization, you also have the opioid-induced hyperalgesia that we talked about. And this pain is like, it's not really specific to a stimuli, it's just pain generalized all over. And it's hard to really map out or hard to attribute to one thing versus the other. All right. And then you also have that neuropathic component. Because that would probably be the first starting phases of this central hypersensitivity syndrome is this neuropathic pain. And that's just due to at the baseline damage to the small fibers or large nerve fibers that supply pain sensation throughout the entire body. So as you can tell, this condition can cause a plethora of real physical painful symptoms, but it also has a high burden of psychological symptoms as well. So patients with sickle cell disease have severely high levels of depression and anxiety. They also have high levels of pain catastrophizing, which makes sense given this central sensitivity picture. Because imagine if you're going throughout life and as someone with sickle cell disease or someone with a chronic medical systemic condition that causes chronic pain, having a paper cut that causes you severe debilitating pain, that is just seems sometimes inconsolable, and sometimes it could really cause you to kind of spiral out and to really catastrophize your pain and go into a state where you think nothing else can help you. And so even the slightest pain sensation can be overwhelming because you just never know how to treat it or if it's going to get bigger or if it's not, or and then just having this condition in general and dealing with all this chronic pain symptoms can cause someone to have post-traumatic stress disorder, in addition to just being introduced to the hospital environment on a consistent basis, such as patients with sickle cell disease. They have high rates of hospitalization. They're in and out of the hospital pretty frequently because they have multiple pain episodes that require immediate treatment. And so just going through that cyclic pain management in hospital environment can cause patients to have a lot of stress around the disease and a lot of trauma. And unfortunately, because again, the primary treatment for this pain and this condition is systemic opioids, patients can sometimes develop substance use disorders, which is why as pain providers and providers in general, we always keep a high level of supervision over how we utilize opioids in the treatment of chronic pain, and that's across any condition in general. Because they can be beneficial, but there can be a point where they can be detrimental to the overall treatment process. All right. And so as you can tell, because pain in these patients, it's due to multiple factors, you can assume that the treatment plan is not just going to be a one and done. You have to look at it from multiple perspectives, include multiple providers, multiple specialists. And that's why we have our amazing pain psych people here at Stanford, because when dealing with chronic pain, I think from my standpoint, being the pain interventionalist, I look at what can I do to treat the pain, whether it's giving an intervention, providing a medication. And then we also have another aspect of physical therapy. So how can we help you deal with pain and still have function and mobility and still give you the activities or the tools to do the activities you love? And then we can't underestimate the utility of pain psych and how the mind and body interacts when dealing with chronic pain. And so that's why we have a large, heavy focus on overall wellness and a holistic approach to dealing with chronic pain that includes all three of those arms. So the medical side, the physical therapy side, and the mental health and behavioral side as well. And so transitioning, I want to focus on each of those treatment arms now. And so when dealing with chronic pain, especially in sickle cell disease, so we have acute pain. Acute pain is pain that happens that is just sudden. It comes up. If you haven't been dealing with it for months and months, it's been maybe a week or so, and you just want to get it treated. And we can treat that a little differently than we do with chronic pain. And so some of these medications might appear familiar to you all. So to treat their like acute vaso-occlusive crises where they're a sickle cell patient is coming into the hospital and they're having like severe joint pain or severe chest pain, just to get them through, we can do NSAIDs, Tylenol. The primary stay is going to be IV opioids, just as a bridge to a more long-term treatment, just to get them out of that acute phase and that really intense pain flare they're having. And then we look at their neuropathic pain, because unfortunately, the medications that treat the acute pain won't necessarily treat their nerve-like pain that they're having. And they could be well experiencing both at the exact same time, which could be very overwhelming for the patient. And so you guys might know these medications like gabapentin or triptyline, topical anesthetics. And so giving those medications to help treat both the neuropathic and the somatic, like the joint pain, can be helpful in the acute setting. And then in a long-term treatment, treating their chronic pain, we continue kind of the same medications that they were being given for their acute pain, but just continuing it more in a long-term fashion, but also offering them other modalities. And so for me, being an interventionalist, I would say, what neuromodulation can we do? Like a nerve block using a TENS unit, maybe even doing an implant of some sort down the line, depending on if they're a candidate or not. And then also physical therapy for these patients, making sure that their pain isn't causing them to lose any mobility or function, or losing them to lose the ability to kind of do the things that make them happy. Because again, even though you're living with chronic pain, being able to go to the grocery store, being able to go out into the community or go to your friend's birthday, that's really going to affect your overall quality of life. And so that's kind of our main focus when dealing with patients with chronic pain is, yes, we have pain, but how can we help them achieve the quality of life that they think that they need to be happy and to live like a full, fruitful life. And so that leads me into like the mental health therapies as well. And so ending in this kind of biopsychosocial model for treating chronic pain. And so we cover our bases by giving them the medications that they require, the interventions that will be beneficial, and getting them to be in physical therapy to help them maintain their strength, maintain their activities, but also how do they cope internally? Because even though you're doing everything on everything right on the outside, does not mean everything on the inside mentally is going well. And so we also we want to be sure to address that. And so this is kind of how the biopsychological social treatment model works, especially when dealing with chronic pain. All right, so the first step, especially with sickle cell disease, is giving patients the education that they need. And so making sure that they're staying hydrated, drinking lots of fluid, because patients who have sickle cell disease, if they become severely dehydrated, that's just going to worsen their occlusive crises, and it's going to worsen the number of acute pain symptoms that they have, and it's going to worsen their pain crises going forward. So they need to stay highly hydrated, making sure they're drinking a lot of fluids, monitoring their urine function, and also maintaining adequate sleep. And I think this is pretty generalizable across any pain condition. Anybody with or without chronic pain, adequate sleep is only going to make any other treatment that you're having, it's going to be more beneficial. Because if you're too exhausted to go to PT, or too exhausted to stay active, or too exhausted to do what makes you happy, then any pain treatment that you're going to hopefully pursue is not going to be as effective. And so this is specific to sickle cell disease. And so we teach these patients to avoid triggers. And so as you can imagine, with an extreme cold environments, your blood vessels tend to like clamp down. And so if you have blood vessels that are already being kind of clogged up by these sickle cell type fibers and sickle cell cells, and the clamping down of the vessel, in addition to that, is only going to worsen their ischemia and decrease blood flow to those joints and small bones and everything like that. So it's only going to worsen their symptoms. So we teach them to often avoid extreme weathers and temperatures that could probably trigger their pain symptoms. And also to manage stress and anxiety, because any kind of stress that you're having with that includes or doesn't include your chronic pain, it's just going to really limit your ability to kind of be fully engaged in the treatment process. And in addition, taking all the prescribed medications as you see fit. All right, so focusing on, so this is kind of going to cognitive behavioral therapy. So now I really want to focus on the pain psychological treatment model here, given the nature of this talk. And so cognitive behavioral therapy, also known in the business as CBT. So this teaches us on focusing on ways to rethinking pain. And so pain in its infancy is just like we receive a stimulus, it's painful, and automatically there's like a negative thought behind it. As it's either like fear, fight or flight. Pain is evolutionarily should be beneficial, but chronic pain is what used to be beneficial is now becoming detrimental. And so we have to kind of reteach our body how it responds to pain. And so it's monitoring your thoughts and feelings behind pain, challenging and reframing inappropriate thoughts behind pain. And so kind of focusing on that right there, that one little reframing aspect is sometimes people with chronic pain, they sometimes take it on a little bit too much. And I've seen patients oftentimes blame themselves when having chronic pain. And so I teach my patients, especially in clinic, when you're experiencing these pain flares, take it in, experience it for what it is, but also understand that there's also a choice involved in that as well. And so I teach my patients, when you're having chronic pain, you're having a flare, you can choose to let it totally control your day or totally control that moment. Or you can choose to take a deep breath, recognize it for what it is. It's an acute pain flare. It's happening. And then how am I going to move through this? How am I going to move beyond this? What is the next step? And so it's kind of taking the more that optimistic approach to chronic pain, instead of living in it for so long that it totally throws you off your entire day or even maybe your entire week. And sometimes I teach patients where, attention to diversion and distraction. Distraction can help a lot. So let's say you're having chronic pain in the moment. And if you're physically able, going out on a walk, going out into the sun, playing with your dog, calling a family friend just to talk about their day, distract yourself to kind of get away from that moment of living in pain and having a pain flare. And then I have patients who, after they do that, a few minutes later, they're like, oh, the pain's gone, or it's severely diminished. So it's just learning tools to recognize it for what it is and like asking yourself, how can I move through this? And just totally rethinking how pain is affecting your life. All right. And so I wanted to focus on CBT is a form of like actual therapy that you get from a licensed provider. And then I also wanted to tack on a little bit of mindfulness. And so when you combine cognitive behavioral therapy techniques with mindfulness-based techniques, they have been shown to have some significantly positive results for those with chronic pain. And so that's like MBCT is kind of the combined terminology. And so this involves breathing exercises, body exercises like stretching, combined with concentration and reflection. And this kind of combined therapy focuses on the present moment without worrying about what will happen in the future or what will happen in the past. So kind of going back like what I just said. So recognizing it in the moment, accepting it for what it is and respecting it for what it is. And like, oh, I'm having chronic pain right now. I'm having a pain flare. I'm not going to worry about how it's going to affect my meeting tomorrow. I'm not going to worry about how I dealt with it in the past. I'm just going to focus on how I am recognizing it right now. And I'm going to remain optimistic about how I'm going to move through it in this moment. And I'm not going to worry about anything else but that. That's also assuming that you have the time, the space, and the bandwidth to do that in that moment. So you can do some mindfulness practices with chronic pain by doing an individual mindfulness meditation. And this meditation can involve sitting alone in a quiet, comfortable space, typically with your eyes closed or your eyes relaxed and not focused on anything specific. This time of quiet calm is about connecting with yourself and calming your nervous system and focusing on the moment. And so let's say I can give you an example of this, because I know a lot of us we're busy, we're out working, we're doing the day-to-day. Some of us may have 5 kids at home. I know the summer is just ending. So sometimes you don't have the time to do this fully. But I don't want you to harp on the time that you have to do it. It's just a practice of doing it. So if you even have one moment to just kind of go into a quiet space, whether it be a bathroom or anything like that, and just sit with yourself, do some deep breathing exercises, acknowledge your heart rate, listen to your heart rate, and just move through the pain while managing your internal stress and anxiety, just for that one moment. I've had patients who it can totally turn their entire day around. But I know that this may not be a privilege to all, but it can definitely be effective. And so more mainstreamed guided meditation, it involves having someone go through it with you. And so I would actually recommend people who are new to mindfulness and new to these mindfulness techniques to actually go through a guided meditation first before seeking an individual practice. Because if you're anything like me, going through it on your own, my mind is wandering. I'm thinking about a whole different things. And so when I started doing mindfulness training back in medical school, it really helped to have someone sit with me to kind of guide me through how to actually listen to my body and listen to my heart rate and kind of shut out the world for a few minutes. And so this meditation, it involves listening to someone either on a recording or in person, who will help you relax into a meditative state and then guide you through the meditation, focusing on relaxing each part of the body one at a time and taking tension away from each muscle. That is often, and this is often called progressive muscle relaxation. And so essentially what you do is you focus on, let's say, your like one thigh muscle, tense it, relax it, acknowledge it, tense it, and relax it. And then doing that progressively, you gain some internal control over that body part, and hopefully the idea is you gain some control over the pain as well. And so this practice helps you be more aware of your muscles and how tense they feel, so that you can actually, when able, you can actually relax them. Guided meditations may focus also on breathing techniques, learning to focus your breathing and slow it, while also visualizing, breathing out negative thoughts and breathing in calm and positive thoughts. So again, it's the whole reshaping, reframing how you're experiencing pain in that moment. All right. And then you also have a mindfulness-based stress reduction, MBSR. And this is a specific kind of, it's under the umbrella of mindfulness techniques. And it's a program provided by trained instructors and typically consists of 8 weekly group sessions covering a variety of formal and informal meditation practices. And this is provided, it's not really sure I guess the standardization of this practice can be pretty variable depending on who you go to, but overall, this is how it is formatted. And so you go through an instructor, and it's a sitting meditation, doing body scan, again, breathing techniques, mindful walking, mindfulness and daily activities. And so it's kind of reshaping not only how you're experiencing pain internally and mentally, but also how you're using that experience and then reshaping how you're physically moving as well. And so learning how to walk mindfully to avoid your triggers in pain or postural changes. I have a lot of patients who have lower back pain because of they just work at a desk for several hours a day. So being mindful about how they're actually working has changed the trajectory of their entire pain treatment plan, just based on that one little change alone in their daily kind of activities. And so mindfulness and chronic pain, the overall goal, no matter what modality you want to choose, is to decrease the repetitive thinking and reactivity to pain, and increase sense of acceptance for unpleasant situations. And so it's kind of like that old saying, like getting comfortable with being uncomfortable, but not letting it totally overpower you and totally rule your life. And then it also helps to improve your emotional flexibility, right? Because when we experience pain, again, we experience almost instinctively and instantly that negative response to it. And so it's learning to experience it, let the negative response come in, and then learning to recognize it as, oh, this is not beneficial for my overall health. So we're gonna reject that and we're gonna put it back out. Okay. And then reducing rumination and avoidant behaviors. So again, just kind of reducing how much you are living in your pain. And this goes back to what I was talking about the fear of the future and resenting the past. I have a lot of patients who, even though they're not having pain in the moment, like let's say that right now their pain is a 5 out of 10, and that's a good day for them. But in that moment, they're so unable to live in that moment and to do what makes them happy because they're so afraid of triggering their pain, or they're so afraid of the pain coming back. And it's this fearful mentality about future issues that really limit their overall quality of life. Rather than in the moment, the pain is okay, but it's the fear factor that comes with it that that causes them to lose focus on what's important. And also enhancing self-compassion, kind of going in that same vein, learning that chronic pain, living with it, it's an experience that almost everyone lives with. If you look at the numbers, the percentage of low back pain in the United States alone, it's like you throw a rock and you're gonna hit somebody with chronic low back pain. And so I think knowing that you're not alone in dealing with this, and even though when you're sitting at home and you're in pain and you might feel like you're alone, everyone is there with you, and everyone is experiencing it to varying severities, but everyone is experiencing it to some level. And so learning to kind of give yourself a little bit of compassion and a little bit of love in the moment can go a long way. And increasing a sense of acceptance for the present moment. Kind of, as you can see, it's becoming a repetitive thing, living in the moment and not worrying about how your pain's gonna come up in the future or the past. And just allowing yourself to be vulnerable and to accept the pain, accept what's happening, but also don't lose sight on how you're gonna move through it. And kind of keeping that optimism is in itself an active therapy, I think, for most people. And inducing the relaxation response and decreasing stress. And so those deep breathing exercises, the mindful movement, the mindfulness meditation, it's all to kind of help you reshape how you're experiencing pain in the moment and how you're going to deal with it in the future. And so ultimately, we hope to reduce your stress and to give you the strength and empower you to take on your pain head on. And so I've had patients who this helps. And so I think if this is something that you're interested in, there are many apps, many websites you can go in, search, and see what works best for you. All right, these are my references, and now I'm going to open the floor to any questions.